Good morning, everyone. My name is Dennis Gerhardstein. I'm with the Ramsey County Attorney's Office. This is our Zoom press event. Probably starting all of 30 seconds early, but we'll do our best to bring people in through my colleague up at the Sheriff's Office, who is your host this morning, Kyle Meestead. But I think you all seen the media advisory at this point. You know that we have 5 speakers. And I want to start this discussion with John Choi, but I want to do 2 quick housekeepings. If you're not speaking, please put your video and audio, put your audio on mute, just so we eliminate as much background noise as possible. And let's just at least honor the presentations thus far. When we get to Q&A, I'll ask that any of the members of the media who would like to ask a question, try to use the hand feature in Zoom. If that doesn't work, or if you can't find it, please text me or send me an email, and I'll make sure that we get the question in the queue. But let's start first with Ramsey County Attorney John Choi.
Good morning, everybody. This is John Choi, and I'm the Ramsey County Attorney, and it's my pleasure to be here today with all of you virtually. I want to, first of all, thank the people that are joining us as a part of this video press event. First of all, I want to thank Ellen Johnson, who is locally here in charge of our SANE nurse program at Regents Hospital. Also, I want to also acknowledge that we have our Ramsey County Sexual Offense Services staff here, Emily Heeman, who runs the program, as well as Pahua Vang. And also MINCASA, the Minnesota Coalition of Sexual Assault. They are the organization that has been pushing very hard at the legislature to pass the bill that we're going to be talking about today. In addition to that, I want to thank my partners in law enforcement, the Ramsey County Sheriff's Office. Today we are joined here by Mike Martin and Jessica O'Hearn, as well as the St. Paul Police Department. Chief Axtell is on the call, and I believe Commander Jim Polkowski is as well. I want to acknowledge the work of some prosecutors in my office who brought this issue to my attention. Karen Kugler, who is our designated prosecutor, as well as Don Baxt. Both of them have been instrumental in helping me better understand some of these issues that we have across the state of Minnesota, but here as well in Ramsey County as well, and Jill Gerber as well from my office. The reason why we're here today, all of us collectively, is that we want to support the Minnesota Coalition Against Sexual Assault's legislative advocacy to pass a bill. It's House File 2983 and Senate File 3462. And what that bill does, and it's so important, is that what it's going to do, it will centralize the storage of sexual assault kits, rape kits otherwise known as, where right now we have a patchwork of inconsistent ways in which local communities are dealing with the actual storage and tracking of these particular kits. I want to stress that this legislation at the legislature is very bipartisan. In the House, the chief author is Representative Kelly Moeller and also Representative Marion O'Neill. Those two have been working very hard, diligently, to try to get this bill passed, as well as in the Senate. We have Senator Warren Limmer and Senator Terry Dietzick carrying this bill. And so this is a very bipartisan bill. The governor has indicated his support of this legislation. I know that this is a very uncertain time with COVID-19, but we wanted to tell the story from our local perspective and also a statewide perspective about why the passage of this bill is so critical. Again, what this bill does is it basically creates a uniform way in which rape kits throughout the state would be stored, would be collected, and then also the system could be held accountable so that the victim and the survivor would always know where or what the status of their rape kit is. And I think that currently right now in the state of Minnesota, we don't have that system in place. And so what we're left with is for local communities to kind of come up with their own solutions. And there's a distinction here between, I think we can maybe better explain it as a part of the Q&A, but there are restricted rape kits and there are unrestricted sexual exam kits. And there's a distinction there. If it's an unrestricted kit, what that basically means is that the victim has presented to the hospital and then is wanting to make a report to law enforcement. In that instance, what happens is the rape kit will be processed and it will be sent to the BCA. And we have, I think, lots of practices and protocols that work in that context, but more clarity could be used in that context. But then with respect to restricted rape kits, and that's where some of the concern is here locally, there really isn't any type of standard by which how those types of kits should be handled. A restricted rape kit would be somebody who presents to the hospital, has a sexual assault examination, but then says, at this time, I don't want necessarily to make a report. And that's common for the victims of sexual assault. And then oftentimes in that instance, what we have found across the states is that there's an issue about who would store these rape kits because there isn't a case number. So law enforcement oftentimes will say throughout the state, well, we shouldn't be holding on to these kits. And then the community and hospitals and healthcare providers are left kind of on their own to kind of figure this out. And what we found out in Ramsey County this past fall is that we had this inconsistent patchwork between various hospitals in terms of what they would do with these restricted kits. Sometimes these kits would actually be destroyed. And what we know in law enforcement and in prosecution is that oftentimes the victim will change their mind. And they will come to a place after they get some services and they will want to report to law enforcement. And I think it's critical that we have all of this kind of figured out. So at the local level, here in Ramsey County, we did not want restricted rape kits to be destroyed. And so what we did is we took measures, extraordinary measures, to figure out a way to purchase a cold storage capability, which would be essentially buy a freezer for Regions Hospital. And today we have a solution so that some of those kits can be kept and stored for a certain period of time. And then as we learned more about this issue, what we learned is that they were very inconsistent throughout the county. I can only imagine what is going on across the state. And so I think that's one of the main reasons why we feel very compelled to ask the legislature to provide this clarity and to provide a comprehensive way in which sexual assault examination kits can be properly stored and accounted for in the system. And this really matters. I know later in the press conference today, we're going to have Mike Martin and Jessica Ahern talk about some of the work that they've been doing. But thankfully, we in Ramsey County have very, very committed law enforcement partners. And we had a situation here in Ramsey County where we had a rape kit that was about to be destroyed. But thankfully, because of the work of Deputy O'Hearn, she was able to save a particular restricted rape kit from being destroyed. And because of her investigation, we were able to bring forward charges, and we were able to get a conviction in our county. And so this legislation really, really does matter. And so what we wanted to do was to make sure that the public fully understood the reasons and the necessity to get this legislation passed and to provide some more information to the policymakers at the legislature. So today we're going to hear first from Ellen Johnson, who will talk a little bit about what's happening with respect to sexual assault examination kits here in Ramsey County. So Ellen, I'll turn it over to you.
Thank you, John. When a victim makes the decision to seek care at a hospital, they spend about 4 hours with a SANE nurse, a sexual assault nurse examiner. And often at the end of that 4 hours, they can't decide on whether to report. Long term in Ramsey County, it has been our practice to store kits at hospitals for at least 90 days if the patient has not reported to law enforcement. It's been my practice long term to call these patients after 90 days and ask them if they have made any decision or if they need some help making a decision about whether to report, and offer to store this kit for a longer period of time. I made up to and even more than 6 calls for every patient that had an unreported case, and made attempts to talk to them and give them options for me to store this kit longer. If after 6 times I was not able to reach them, then I did destroy the kit, which typically was about 9 months to a year, maybe longer, depending on how long it took me to go through this process. So currently I store kits indefinitely if I'm able to reach the patient and they say they're not sure and they want me to hold it. And I have always referred them on to SOS Advocacy to help make that decision. With our long-term partnership with them, it has been very helpful for them to be able to talk to patients. So what this does is it preserves their choice. It's very victim-centered if the kit is held onto. The problem comes if I'm not able to reach patients and the kit gets destroyed. And occasionally that has been very traumatic because a year later, patients may say, "Do you still have that kit?" because they would like to report. In Ramsey County in 2019, we did over 400 victim exams. At Regions Hospital, we have a 65% report rate for the victim exams that we do. So what that means is on a yearly basis, I will need to store about 90 kits of evidence from Regions Hospital in order to preserve that patient's right to report at a later date. And this is a storage issue, and this has not been possible with one side-by-side refrigerator at Regions Hospital. Now, however, with this beautiful new 3-door locked refrigerator, courtesy of John Choi in the Ramsey County Attorney's Office, I can store these kits up to about 2 years. But this is a short-term solution, and long-term, we do need a statewide solution. So I know that Jude Foster from MinCasa has much more of a statewide viewpoint and will be able to cue us into statewide issues.
Thank you, Ellen. So Ramsey County is not unique in that all 87 counties in the state of Minnesota are really struggling with these issues. So the first thing that this bill is really looking at, that MinCasa is excited about, is a statewide sexual assault kit tracking system. So currently we have no sexual assault kit tracking in the state of Minnesota. So victim survivors have no way of accessing the status of their kit. And we also believe, in addition to being victim-centered and allowing victim survivors access to that kit, it also holds the criminal justice system, all of us, accountable. If we had a statewide tracking system, we could avoid future surprise sexual assault kit backlogs. We would know where that kit is. Can you go to the next slide, please? As Ellen was saying, we do not have any kind of a policy on kit storage in the state of Minnesota. We have no statewide coordination or a statewide storage facility, which many other states have. And the difficult issue here is that in some communities, hospitals don't see or they do see that unrestricted or the restricted kit as being evidence, and they don't feel that they are the appropriate discipline to be storing that kit. Law enforcement does see it or doesn't see it as evidence because it hasn't been reported to them. So what has been happening statewide is that in some communities, hospitals and law enforcement, which have spent years building strong multidisciplinary relationships, are crumbling because of arguing in some communities about 10 to 15 kids. And as Ellen was saying, and John Choi was saying, across the state, there's just no consistency. So what we're seeing oftentimes is that communities just run out of room. So sexual assault kits are being destroyed anywhere from 3 to 9 months in most communities. We know that victim survivors after that 1-year anniversary are much more likely to convert a restricted or unreported case to a standard case. So that's why we want to hold kits for 30 months. Can you go to the next slide? So as Ellen was saying, this really gives victim survivors the opportunity to take the time that they need to decide if they want to engage with the criminal justice system. We know the vast majority of victim survivors know the person who sexually assaulted them, which can really cause bumps. What if it's a family member? What if it's a partner? What if it's a member of a tight-knit community? So victim survivors really need that time to decide whether they want to report or not. This also enables victim survivors to know the status of their kit. In other states where they have statewide tracking, victim survivors can log into a system and know where their kit is. Is it at the crime lab? Has it been tested? And it really gives the rest of us in the criminal justice system the opportunity to have transparency and accountability to our communities and to victim survivors of sexual assault. So I believe Mike Martin is next.
Thanks, Jude. I had to unmute myself there. I want to say thank you to the Ramsey County Attorney's Office and County Attorney John Choi and health partners who employ the same nurses that we have, and Min Casa for everything that they do, as well as our partners at the St. Paul Police Department. In 30 plus years of law enforcement, I've seen that these cases are some of the most complex cases that we face. There are quite a number of reasons why victims are reluctant to report to the police or hesitant to pursue charging in cases. As Jude said, they may know the suspects. They could be family members. They could be going to the same church, and sometimes the victims blame themselves. And it takes a while for them to work through their trauma and realize that they are victims or survivors, and that they want to pursue a case against the suspect. In 2019, in partnership with the County Attorney's Office, we received a state grant for 2 years to fund the position that Deputy Jessica O'Hearn is now in to pursue sexual assault cases. And she'll talk about a case that she worked where we had a victim who had a 7-month-old case that she decided she wanted to pursue, and the kit was almost destroyed because of this inconsistency. And I can tell you that it would be greatly helpful for law enforcement, for prosecutors, for everyone involved, and especially the victims, if they had a centralized system where they could make that decision after having time to have thought about it. So the Sheriff's Office very much supports this legislation. It would provide some consistent storage and policies across the state that would eliminate a lot of the backlogs and also eliminate the possibility that we may let one of these cases slip through the cracks and not do our due diligence for that victim. So I'm going to turn it over to Jessica to talk about that case.
Jessica, you got to unmute yourself.
There we go. Thank you. I was trying. Yes, I had a case back in 2018 where the victim came forward. After 7 months, she decided that she wanted to pursue charges. This was a case that was actually over at HCMC. So I called HCMC and they said there was a kit. It was just about to be destroyed and it had them hold it for me. With that, we were able to go through the prosecution for that case. But it got me started thinking. I wasn't sure why the kit was about to be destroyed, so I started figuring out some of that. I found out a lot of kits were getting destroyed, so I asked for permission and we started taking all restricted kits from HCMC and holding them. So every 6 months now, I get a hold of HCMC and we hold all kits for everyone in Ramsey County right now until we figure out this storage issue.
And Jessica, I think one important point that we're trying to make is that communities across the state of Minnesota should not be having to rely on the heroics of an investigator to go out and collect rape kits from hospitals. What we really need to have is some very clear direction about where hospitals could be sending their kits to. And in this particular legislation, what it would do is it would allow for hospitals to send them directly to the Bureau of Criminal Apprehension, and they would store those kits for a certain period of time, which we think would be very, very important, not just here in Ramsey County, but across the state of Minnesota.
Correct.
So I think what we want to do now is turn it over to our chief in St. Paul, Chief Todd Axtell, who will talk a little bit about the need for this kit and the work that's been done here locally.
County Attorney Choi, thank you very much, not only for your leadership throughout the state and supporting and empowering survivors of sexual violence, but pulling this together. It's very important. Like what has been said throughout this conference today, is this is all about empowering and supporting survivors of sexual violence. This is a crime that plagues our community. It's insidious at every level, and we have to do everything we can with all of our partners to support those who have gone through these tragic occurrences. In St. Paul, we're very proud of the fact that we test every rape kit within 2 weeks. State law mandates 60 days, and these are the regular sexual assault kits. We're going to continue to do that and working with all of our partners. But this bill that we're talking about today, this legislation, truly is something that really makes a lot of common sense throughout the state of Minnesota. 87 counties need to be on the same page, and this law will allow us to do that. It's important to note that sexual assault trauma has no timeline and it has no boundaries. And we have an obligation to be prepared to investigate for the survivors on the survivors' timelines, not a timeline that society decides to make up or law enforcement decides to make up. And the bill is about ensuring evidence will be there when the victim is ready, and the victim is ready on their timeline. Again, not ours. Thank you very much.
So I think just before we go to questions, again, I just want to reiterate the reason we're trying to bring forward these stories at the local level is because we should not have to have a local community trying to scramble to find a refrigerators or safe storage. We should not have to rely on the heroics of one particular officer to go and try to get all of the exam kits that are out there so that they don't get destroyed. We really need to have some centralized framework in which that's where there's proper funding to ensure that this is taken care of across the state of Minnesota so that we can serve the survivors and victims of sexual assault in a victim-centered way, and then also to be able to hold the perpetrators accountable in these types of situations. So with that, Dennis, I'll send it over back to you, and you can kind of moderate the Q&A.
Well, in the world of our Brady Bunch view here, I'm going to attempt to do the hand raising piece. If that does not work, please use the group chat. That worked very well early on here. And we'll get to all of you. I just want to, if I were to miss someone because they're not in my screen at the moment, please resend that question or your question, the fact that you want to ask a question on chat. So who has the first question? You can also just raise your hand too. I can see you. AJ, I imagine you have something in your mind. Let's unmute AJ if we could. Go ahead.
Can you explain why at this point you're not advocating for universal kit testing on the unrestricted kits?
Jude, do we want to start with you on that question, or?
Actually, Lindsay Bryce, who's the Law and Policy Director at MnCASA, is on this call. Lindsay, do you want to address that?
Yeah, I can address that. It's not, AJ, it's not that we aren't advocating for that. We support that. But we believe that moving Minnesota towards a system of centralized storage and a tracking system is a big step in that direction, and will really give us more information about what kits are and aren't being tested in order to eventually move in that direction. So it's not that we aren't advocating for that, it's that our priority, MnCASA's priority, is centralized storage and a tracking system. And just backing up a little bit on the tracking system, a tracking system will enable a law that already exists from, Jude, help me with the year, 2018. That requires that victims are able to know what's going on with their kit, essentially. But there's not a system in place to actually make that happen. Right now, the way that victims can enforce that right is through a bunch of phone calls, right? There's not an easy system to make that happen. So tracking will support that law, enable victims to access that information, and potentially and collect data on what kits aren't being tested as well.
Got a follow up there, Dennis.
Yeah, jump in.
So the state told us that, or state lawmakers who were sponsoring the bill saying, look, this year, anything with a fiscal component that's not COVID related is dead. Do you think this can be still pushed through this year, these steps that you're calling for?
So I have not heard that directly from any of the authors. I spoke to one co-author yesterday who is very supportive of this continuing to move forward. My understanding is that the governor's office continues to be very supportive of this moving forward. It's the language, the entirety of the language of these two bills, which includes the testing all unrestricted kits language, is in the, I'm going to stumble over the name, it's a really long name, the Public Safety and Criminal Justice Committee's, their appropriations bill that's being heard on Wednesday and Thursday. That language is in their bill, the entirety of it. So we are not hearing, obviously there are going to be financial considerations that go into all of this, just like there are in any other year. And COVID-19 is absolutely presenting an added challenge around that. However, it's as far as I know, it's moving forward. It's being heard in the House this week.
John, do you want to add anything to that?
Well, I mean, at the end of the day, there are realities with respect to the financial condition of the state of Minnesota. But what we're trying to do is we're trying to lift this up, that we're saying that in this particular instance, a solution is really critical, because the absence of that solution, what it will mean across the state of Minnesota, unless the local community can somehow figure out their own solution. Like in our case, we have the work of Jessica O'Hearn, and we purchased a refrigerator, but we're kind of cobbling all of this together, and it still runs into when we work with other jurisdictions, challenges. So in the absence of this legislation, what happens is that the people that lose are the victims of sexual assault, and also the people that would want us to be enforcing our laws against the perpetrators of sexual violence. And so what we're asking for, and we're asking the legislature to be as creative as they can to figure out a way to get this done, and to figure out a way to find the funding so that the BCA can do these things for the local community, and it will make a world of a difference. Otherwise, we suffer in this kind of unregulated patchwork of response, and that's not what we need today for our victims and survivors of sexual assault.
Okay, I think Sarah Horney, you had a question about the price tag associated with the bill, and I will include a copy of the criminal complaint that relates to the case that Deputy O'Hearn referenced earlier. So maybe you want to restate that question. Can someone unmute her?
Can you hear me?
We can.
Okay, hi. Yeah, I was just interested in knowing a little bit more about the case that Deputy O'Hearn was involved in, where she was able to save the kit, and then it sounds like that case moved forward and the defendant was convicted. Is that correct?
Correct.
Okay, yeah, so just interested in some more details on that, and then also interested in what the price tag is associated with this bill, if it were to be passed.
I'm happy to start with the criminal complaint and send that out with the rest of what we're going to send out. Is that a starting point for you, or do you want to hear more from Deputy O'Hearn?
That works for me, unless she wants to chime in on kind of watching the case follow through the system.
Sure.
Yes, we'll have the complaint sent out. It was very interesting watching the case go through, since it was a delayed case. I was interested to see how that would work with the sexual assault kit that we had just gotten, but everything went really smoothly with this case. There's bumps in every case that we do at this point, but it was really nice to see that we were able to have the evidence this time to help with the prosecution.
Great. And who would like to handle the fiscal note part of the discussion?
I can just briefly address that. And Dennis, maybe can you include the fiscal note in what you're sending out also?
I will.
So I only have one screen, so I don't have the exact numbers in front of me because I only have one screen and I'm looking at all of you right now. However, when you look at the fiscal note, there's the bill, there's 4 components to the bill. There's this centralized storage, there's tracking, there is a statewide consent form to really continue standardizing what information folks are getting and offering. And then there's the testing all unrestricted kits piece. When you look through the fiscal note, the largest financial component to it is really that testing all unrestricted kits. So backing off that piece and really only looking at the centralized storage and testing makes that fiscal note much, much smaller than the total than the total you'll see in the document. I'm not going to parse out all the detail because it's in there, so you can look through it. But that's really what we're talking about.
And I'll send that along as part of what we send out here inside of an hour. Any other questions from our friends in the media? I'm seeing names. Go for it, AJ.
So does this really boil down to saving what can be saved this year from these rape kit reforms?
I'll leave that to whomever likes to chime in.
I mean, yes and no. We support all of these pieces, but if you look back at MnCOSA's initial legislative agenda for 2020, our agenda is statewide storage and tracking. So these pieces that we're talking about today they were our priority at the beginning of the legislative session, and they continue to be our priority.
Yeah. Okay. Anything else from the group? I don't want to overstay our welcome, but I also appreciate this is a unusual way to do a press conference, so I appreciate everyone's patience as well. All right. Well, as needed, something occurs to you later, feel free to send me an email with a follow-up question. I can certainly find the appropriate person to address that, and we will send out basically a summary of everything we talked about in a press release with a bunch of handy links at the end of all of this, and a picture of the refrigerator that we referenced in this discussion. I heard someone chime in.
Yeah, this is me. Liz Sawyer from the Star Tribune has a question.
Oh, there you go. Perfect. Thank you. Liz, jump in.
Hi there. Can you guys hear me?
We can.
Yep.
Okay. I wanted to know, I didn't see in the draft proposal how many additional lab techs would be included in this proposal. Because I saw that the undisclosed amount of funding would also fund additional scientists. Do you guys have a number in mind?
Jessica, did you have an answer to that? Oh, okay. I thought you unmuted yourself at the same time. This is Lindsay. I guess I'm not totally clear on your question. So when you go through the fiscal note, it includes some additional scientists for testing all unrestricted kits. Again, I have to look back at it. And the numbers, well, backing up, MnCOSA is not driving the numbers piece of this. So the numbers part is really coming from the BCA and all of the agencies that would be actually doing this work. So I'm speaking to it from that perspective, but the additional lab techs that you're talking about, the vast majority of those in the fiscal note are related to testing additional kits.
Oh, okay. Do you guys have a number in mind that it would take to sort of rectify this backlog in terms, or would that be a question more for the BCA?
Well, currently, the Minnesota Coalition Against Sexual Assault, the Minnesota Office of Justice Programs, the BCA, excuse me, we went in on a sexual assault kit initiative grant. In fact, just this week, I am writing our third SAKI grant. So it's a statewide grant, but we have piloted in Anoka County. So we're also working with the Anoka County Sheriff's Office and County Attorney's Office and Alexandra House, which is a victim services agency, along with Alina Sexual Assault Nurse Examiner program. So we are almost done testing our kits in Anoka County. We will be moving to St. Cloud next. We're kind of going by the 2015 audit that was done by the BCA of all unsubmitted kits from law enforcement agencies across the state. So we're kind of going community to community based on who had the most kits. So yes, there is movement on that, and I'm sure you've seen in the press, Duluth, for example, did test all of their unsubmitted kits.
Sure. Thank you. I appreciate you guys doing this.
All right.
I have a quick follow-up.
Yeah, let's do one last question there, AJ.
Yeah, it's probably for Jude. When you're talking about a statewide tracking system, you are talking about an online system that victims can log into and track exactly where their kit has ended up, correct?
Yes.
Okay, good clarification. All right, thank you all very much for your attention and your thoughts, and we will be in touch in the old-fashioned email world very shortly. And thanks for everyone else who was able to join us this morning.
Makes sense.
All right,
Thank
bye-bye,
you.
guys.
Bye.